Have the patient sit in a comfortable and upright position. Examine the ear through inspection and palpation of the auricle and its surroundings. Observe shape, color, swelling, masses, deformities, skin lesions, or discharge. Check if the patient has tracheal tenderness. Do this for both ears. Otoscopy must be done with proper handling of the otoscope. Hold the pinna and gently rotate the auricle backward and upward. This straightens the ear canal. The speculum is inserted slowly into the canal without touching bone. Inspect the ear canal and all quadrants of the tympanic membrane. Note cerumen, color, nose. Note shape, symmetry, color, and patency of the nasal alley. The paranasal sinuses, frontal, sphenoid, ethmoid, and maxillary must be palpated. Check for tenderness over these areas. Palpate for discontinuities, mobility, or signs of fracture. Evaluate the nasal vestibule and anterior nasal cavity using anterior rhinoscopy. Make sure your head mirror and light source are properly placed to provide adequate lighting. With the patient in a sniffing position, hold the speculum properly while bracing with your index finger. The speculum is inserted with blades closed and carefully withdrawn with blades slightly open. Avoid discomforting the patient at all times. With mouth closed. Note symmetry, color, and surface condition. Ask if the patient has dentures before examining the oral cavity. With the mouth partially open, insert a tongue blade to depress the tongue. Inspect the palates, buccal mucosa, gingiva, teeth, and tongue. The patient maneuvers the tongue to assess its dorsal and lateral aspects, the floor of the mouth, and the tongue's rotation and limitation of movement. If inspection reveals changes, the affected region or structure should be palpated using a gloved finger to assess consistency and depth. Posterior rhinoscopy may be done to assess the nasopharynx and posterior nasal cavity. The tongue is carefully depressed, and then a pre-wound mirror is introduced between the soft palate and posterior pharyngeal wall. Indirect examination of the larynx is performed with a laryngeal mirror. The examiner grasps the protruded tongue with gauze and pulls the tongue forward. Advance the mirror beneath the palate to the uvula. Lift the uvula with the back of the mirror, then push it backward and upward. Have the patient say "hee" to assess laryngeal function. Evaluate the tongue base, oropharynx, and hypopharynx.